Assalamualaikum everyone, welcome back to this channel. So this is me Alia Waheed, and in this video we are going to start the topic of beta adrenergic blocking agents. So in the previous lecture we have discussed about the alpha adrenergic blocking agents, and we have discussed their types. We have discussed their phenoxybenzamine, phentolamine, and different types of other alpha F1 agonists, which are parazoline, terazoline, doxazoline, and lastly we have discussed yombine. Now we are going to start the receptors which are acting on the beta receptors. So first thing you have to remember that all the beta blockers, they are competitive means they are ready to fight. So in the alpha blocking agents, we have studied only the phenoxybenzamine was a drug which is non-competitive, while other all alpha blocking agents are competitive. In case of beta, all drugs are competitive, no one is non-competitive, and they are sympatholytics, decreasing the activity of sympathetic nervous system. Then further they have two types, some are selective beta blockers and some are non-selective. So if we study the case of non-selective, so non-selective drugs are three: propanol, nadol, and timol. So these are the non-selective drugs. They can act on both receptor beta 1 and beta 2. Now let's discuss about the selective drugs. So some selectives act on the beta 1 and some act on the beta 2. But remember one thing, that the beta 2 agonists are not used clinically, so therefore they have no clinically evidence, and they are and we don't study them in this lecture. Now we are going to only focus on the beta 1 selective blocking agents. So the beta 1 blocking agents, some are these beta 1 antagonists, but some beta antagonists have partial agonist activity within themselves. So there are the two examples of beta agonists which have agonist activity in them, which is acetobutol and pindole. Let's discuss about only beta 1 adrenergic agonists. So these are these types. So acetobutol is present in both of them. It also acts as a partial agonist as well as an antagonist, while other all of these three drugs are placed inside it. So in order to remember these drugs, you will remember that AC का एंटीना बेटा 20 दफ़ा ठीक करवाया है, मगर नहीं ऐसा नहीं, मतलब नहीं ऐसा हुआ। तो ये इसका निमोनिक्स है, इसका याद करने का तरीका है। सो अब हम लोग चलते हैं जी नॉन सेलेक्टिव बीटा ब्लॉकर्स, एंड द फर्स्ट ड्रग विच इज़ प्रेजेंट इन द नॉन सेलेक्टिव बीटा ब्लॉकर्स इज द propanol. So one thing you have to remember that all of these beta adrenergic blockers, they end with a word लोल, ठीक है। सो हर ड्रग के एंड में ये वर्ड लाजमी होगा, जिससे आप रिकॉग्नाइज भी कर सकते हैं कि ये क्या होंगी। और एक और चीज़ ये है कि ये जो तमाम बीटा 1 एंटागोनिस्ट हैं, ये सब कार्डियो सिलेक्टिव ड्रग्स हैं, कार्डिक सिस्टम पे ये एक्ट करेंगी। अब हम लोग प्रोपेनोल के देख लेते हैं। सबसे पहले तो चीज़ ये है कि ये नॉन सेलेक्टिव है, जिससे हमने के बात किया कि इट कैन बाइंड विद बोथ ऑफ द बीटा रिसेप्टर्स बीटा 1 एज वेल एज ऑन द बीटा 2। सेकेंड पॉइंट विच इज़ रिटन हेयर दैट इट कैन एंटर द योर CNS सिस्टम, मीन्स इट इज़ लिपोफिलिक इन नेचर, इट इज़ नॉन पोलर in nature, therefore it can enter into your CNS effects, and every drug which enter into CNS effects show some kind of CNS effects like dizziness, fatigue, and something like that. So next thing is that your propanol is quite competitive, so it is ready to fight and then it will take place. And one thing point I have written that it doesn't allow the binding of your neurotransmitter or your agonist, which is isoproterenol on the beta 1 and beta 2 receptors. So let explain me this point with the help of diagram. So this is your beta receptor, can be beta 1 and beta 2. Now what will be going to happen, let's suppose the propanol drug is given here, is present near that receptor. The epinephrine, norepinephrine, which is the neurotransmitter which has to bind with it, and the second agonist, which is isoprotestrone, it is also present here. Now what is going to happen in the presence of this pronol what will do, it will rapidly attach itself with it, never allow this neurotransmitter or agonist to bind with it and to perform their activity. So this was all about this. Now we discuss the actions of them. Now let's discuss their actions. So first of all, because they are acting on beta 1, so therefore beta 1 is on the heart, so they will act on the following parts of heart. First is the SA node, which is present on the heart, then it will act on the arterioventricular node on the heart, and it act on the myocardial cell, mean muscle cells of the heart. ठीक है, तो मैं वो लिख नहीं रही हूँ, आप लोगों को खुद पता है. सो इस वजह से जब आपकी बीटा 1 पे जाके अटैच करेगा, इट विल डिक्रीज द हार्ट रेट एंड डिक्रीज द ब्लड प्रेशर आल्सो. So the beta 1 receptors are also present on the kidney. So on kidney they are decreasing the synthesis of renin, causing decrease in the blood pressure. And it is also present on the blood vessels. On the blood vessel beta 2 are present, and they are responsible for the vasoconstriction, but this vasoconstriction happens in the peripheral part, so therefore it is not so severe that it can be observed. Okay, next thing, it also present on the lungs, on the beta 2 receptor of the lung, causing bronchoconstriction. On the liver beta 2 are present, they are causing glycogenolysis, mean they are decreasing the breakdown of glycogen, means they are preserving more and more glucose, so it is beneficial for the diabetic patient. So now let's discuss some therapeutical uses of propanol. So it is used in the hypertension. So what is mean by hypertension? Mean high blood pressure. So as we have studied in their action that by acting on the heart, they are decreasing your blood pressure. By acting on the kidney, they are decreasing your blood pressure. So therefore, the patient having high blood pressure take propanol, and then they release their decrease their blood pressure. And then it also used in the angina pectoris or the heart attack. So heart attack is due to the high heart rate, so therefore it is decreasing the heart rate, therefore it can be used. Second, myocardial infarction. So the myocardial infarction is the first heart attack. Okay, so it is also used in the chronic heart attack or in the first heart attack, and it also helps to prevent the second heart attack, so therefore it is very beneficial. Also used to treat the migraine, as we have discussed, it is can enter the CNS, it is lipophilic in nature, therefore it is has quite effects on your central nervous system, and therefore it is decreasing the headache, which is the migraine. Then the person with hyperthyroidism, so the person with hyperthyroidism, this person has high sympathetic activity, so therefore it is also used to treat it and decreasing the sympathetic activity in a particular person. Then it also used to cure the cardiac arrhythmia, mean up and down in the heart rate and such like that. And lastly, it used in the diabetics. So I have explained that it because it is decreasing the process of glycogenolysis, mean the breakdown of glycogen. So therefore, they are preserving more and more glycogen into your body. So therefore, it is decreasing the concentration of sugars, decreasing the concentration of glucose in your body, and therefore it is help the diabetic patient to treat with it. Now let's discuss about their kinetics. So they are usually oral. Taking drugs like propanol, you will orally take it. It will release through your urine, and its volume distribution is very high, like 4 liter per kg. So therefore, it has very long half life. Then contraindication in the case of asthma and COPD, because as we have discussed in the lungs, they can cause bronchoconstriction. So in the asthma or COPD patients, they have already have bronchoconstriction, so therefore we cannot give these drugs to them because they can cause death to these patients. Now let's discuss about their adverse effects. So here are some adverse effects of propanol. Is written that it can cause bronchoconstriction, so therefore we cannot give these drugs to asthmatic patient. Then it can cause various kind of drug interaction, like some drugs are present which can stimulate its metabolism. Means these are the drugs which can stimulate the metabolism of propanol, like barbiturate, rifampin, and phenyltoluene. So these are the drugs. Some drugs inhibit the metabolism of protanol. These drugs are cimetidine and fluoxetine. So these are, so it has CNS effects, so it means it can cause fatigue, dizziness, and confusion and such thing. And it also adverse effect like sexual impairments, especially in the men. So these are some adverse effect of propanol. Now let's discuss the second non-selective beta adrenergic agonist drug. So this is the second adrenergic agonist, Nadol. This is one drug. Second drug is Timolol. So these are the two beta adrenergic drugs. So because they have same kind of affection, so therefore they are written in one paragraph. So they are non-selective, acting on both beta and beta 1 and beta 2. They are competitive inhibitor, therefore they are going to fight, and they have half a long half life, more than propanol. Now let's discuss about their action. So the more action is written of timolol because it is used as an eye drop. So in the eye, you know very well, the beta 1 and beta 2 receptors are present. So this drug will inhibit these receptor and causing the decrease in the production of aqueous humor. If the aqueous humor production decreases, then your intraocular pressure decreases, and it is used to treat the patients of glaucoma. So in the patients of glaucoma, the intraocular pressure is increased, so therefore, in order to decrease it, we will give these patient timolol and it will treat them. Kinetics is that it is given in the form of eye drops, which is directly added into your eyes and causing decrease in your intraocular pressure. And duration is that its duration, its action start of within the 30 minutes and remains up to 12 to 24 hours. So therefore, it has very long duration that it can make its effect till a day, till a complete day of 24 hours. Now let's discuss the selective beta adrenergic drugs. So we have discussed here some selective beta drugs which are given here. Okay, so I have told all of these drugs here, so I am not writing the name of these drugs again and again. Now we are just going to see their actions and their reactions like that. So first thing, they are selective in nature. They are only acting on your beta 1, not action on your beta 2 receptor. They are competitive, always fighting, and they are cardioselective. So cardioselective is why, because they are acting on your heart, because beta 1 receptors are on your heart and on your kidney. So the more effect of beta is seen on your heart, so they are decreasing heart rate, decreasing blood pressure. On the kidney, they are also decreasing the blood pressure by decreasing the synthesis of renin. And after that, if you see the kinetics of it, so some drugs have different kinetics, like isomalol. This, it has very short half life because of the presence of ester groups in them. And second is nibavol. It is releasing nitric oxide, so therefore it can cause vasodilation into your blood vessels. Uses of these drugs in the heart attack, in the hypertension, or in the myocardial infarction. So always every beta adrenergic drugs, they have use in the heart attack, in the hypertension, in the myocardial infarction. Now let's discuss some beta antagonists which have partial agonist action. So we have discussed that we have two drugs here which can act as antagonists as well as the agonist section, acetabulol and pindol. Now let's discuss about them. So here is written the explanation of them. So this is the receptor, which is the beta receptor. Now what is the antagonist with having partial agonist sector? So it has different from the antagonist. So for example, I have drawing here agonist. This is the agonist of that receptor. This is antagonist, and this is partial agonist. So now this agonist will bind with it and start its cellular response, and its cellular response is very strong. Now this is your antagonist, so it is blocking this receptor and doesn't allow any kind of cellular activity to perform. And this is the partial agonist as well as antagonist. When it's bind, it show the activation of receptor, so it activate that receptor, but it decrease the cellular response. So what are the actions of them? Again, they will act on heart, decreasing the heart rate, and they also act on liver, causing decrease in the lipid and carbohydrate metabolism will be disturbed. So uses is again hypertensive, and these drugs cannot be used in case of heart attack or in case of arrhythmias. So this is the special kind of case for it. Now the beta adrenergic blockers, this is ended here, but we have some kind of antagonists which act on both alpha and beta. So here are the antagonists here. They act on both alpha as well as beta. These are the two drugs, लेबिटॉल एंड क्रेविडिलोल. ठीक है, सो इनको याद रखना है. ये बीटा के लिए नॉन सेलेक्टिव है, बीटा वन पे भी अटैक करेंगी, बीटा टू पे भी. लेकिन ये अल्फा के लिए सिलेक्टिव है, सिर्फ अल्फा वन पे अटैक करेंगी, अल्फा टू पे अटैक नहीं करेंगी. सो अब अल्फा वन पे कर रही हैं तो इन्होंने क्या करना है, ब्लॉक कर देना है अल्फा वन को. और अल्फा वन वैसे नॉर्मली वैसो कंस्ट्रिक्शन कर रहा है, बट ब्लॉकेज होने के बाद वैसो डायलेशन और बीपी कम. बीटा टू को भी ब्लॉक करते हैं. बीटा टू नॉर्मली आपकी वैसो डायलेशन करवा रहा होता है, बट ब्लॉकेज के बाद वैसो कंस्ट्रिक्शन करवाएगा. लेकिन इसका हम क्लिनिकली इफेक्ट नहीं देखते हैं, इसका इफेक्ट बहुत ही माइनर होता है कि हम उसको नेग्लिजिबल कर देते हैं. देन अगर हम कार्बिडिडोल की बात करें तो ये लिपिड की पेरोक्सीडेशन को कम कर देता है, जिसकी वजह से ब्लड वेसल्स को थिक करने में ये यूज़ होता है, और हार्ट फेलियर में इसका पार्टिकुलर यूज़ है. अब हम इनके थेरेपेटिकल यूजेस पे आ जाते हैं इन दोनों ड्रग्स की. सो यहाँ पर इसके थेरेपेटिकल यूजेस हैं. सबसे पहले लेबिटोल इस ड्रग के यूजेस बताए गए हैं कि एक तो प्रेगनेंसी में जो इंड्यूस होता है हाइपरटेंशन, उसको ट्रीट करने के लिए आप लेबिटोल दे सकते हैं. सो ये क्लिनिकली यूज़ हो रही है. इसी तरह एमरजेंसी आ गई है, कोई हाइपरटेंशन का पेशेंट है और फौरी तौर पर एमरजेंसी क्राइसिस है और उसको बहुत ज़्यादा बीपी हाई हो चुका है और आपने एमरजेंसी में कोई भी ऐसी ड्रग देनी है तो आप लेबिटोल दे सकते हैं. लेकिन कॉन्ट्राइंडिकेशन क्या है, जब आपको एक्यूट हार्ट फेलियर हो तब आपने इसको नहीं देखना, क्योंकि इसका एक्शन थोड़ा स्ट्रॉन्ग है. नेक्स्ट कार्बिडोल की अगर हम यूजेस की बात करें तो ये क्रोनिक हार्ट फेलियर, जब आपका हार्ट फेलियर बहुत ज़्यादा क्रोनिक और एंड स्टेज पे पहुंच जाता है तब हम कार्बिडोल भी दे सकते हैं. ठीक है, एडवर्स इफेक्ट इसके हैं ऑर्थोस्टैटिक हाइपोटेंशन और डिजीनेस है. ऑर्थोस्टैटिक हाइपोटेंशन ये एक ऐसे टाइप का लो होना है ब्लड प्रेशर का, जिसमें आपके पास पता क्या होता है कि जब पेशेंट लेटा हुआ होता है या बैठा हुआ होता है तो वो उसको चक्कर नहीं आते, बट जैसे ही वो पेशेंट खड़ा होता है तो उसको चक्कर आता है और एकदम वो नीचे गिर जाता है. तो इसको कहते हैं हम ऑर्थोस्टैटिक हाइपोटेंशन. कि इन ड्रग्स के अंदर इसके साथ यही होता है कि जब भी पोजीशन स्टैंडिंग में आती है तो एकदम सारा खून जो है वो वेनस पुलिंग के ज़रिए से लेग्स में चला जाता है, जिसकी वजह से जो आपके मेजर ऑर्गन्स है जैसे हार्ट हो गया, ब्रेन हो गया, उसको ब्लड कम जाता है और जिसकी वजह से एकदम से चक्कर आता है और पेशेंट बेहोशी की तरफ चला जाता है. सो उसको हम ऑर्थोस्टैटिक हाइपोटेंशन कहते हैं. सो ये ड्रग्स ऑर्थोस्टैटिक हाइपोटेंशन कर सकते हैं. इस वजह से हम ये ड्रग्स पेशेंट को रात के टाइम देते हैं ताकि उन्हें डिजीनेस फील ना हो. देन रेस्पिरिन ये एक अलग केस है. ये न्यूरोट्रांसमीटर की अपटेक को रिलीज़ को डिक्रीज़ करता है. ठीक है, तो यहाँ पर हमने साइनेप्टिकल न्यूरॉन जिस तरह से बनाई थी तो हमने कहा था कि इस न्यूरॉन के ऊपर एक को ट्रांसपोर्टर होता है. सो रेस्पिरिन जाके उसी को ट्रांसपोर्टर को नेगेटिव इफेक्ट करता है, उसको रिलीज़ को ब्लॉक करता है, उसकी रिलीज़ को. सो ये एक प्लांट एल्कोलाइड है. और बायोजेनिक अमाइंस जो एपिनेफ्रीन और एपिनेफ्रीन ये बायोजेनिक अमाइंस हैं, तो ये उनकी रिलीज़ को रोकता है. ड्यूरेशन इसका बहुत लॉन्ग है. एडवर्स इफेक्ट इसके ये हैं कि ड्रग इंट्रैक्शन काज करता है और सिजोफ्रेनिया ये एक ब्रेन के रिलेटेड डिजीज़ है. सो ये उसके एडवर्स इफेक्ट आ जाते हैं. सो आई होप कि आज का लेक्चर आपको समझ में आ चुका होगा. मैंने हर एक चीज़ आपको समझा दी है. सो हमारे पास एड्रेनर्जिक एंटागोनिस्ट का चैप्टर भी कंप्लीट हो चुका है. नेक्स्ट लेक्चर में हम लोग नेक्स्ट चैप्टर को कवर करेंगे. आई होप कि आप लोगों को आज का लेक्चर अच्छा लगा होगा. अगर आपको वीडियो अच्छी लगी है तो प्लीज़ सब्सक्राइब कर दें चैनल को, लाइक का बटन दबा दें और सब्सक्राइब और बेल आइकन प्रेस करना बिल्कुल मत भूलिएगा. टेक केयर ऑफ योरसेल्फ. मीट यू सून इन द नेक्स्ट लेक्चर. टिल अब अल्लाह हाफिज़.